Although obesity rates and weight-based discrimination continue to rise, many nurse practitioner students report feeling underprepared to manage obesity effectively and without bias. To address this gap, the present study implemented an underused but promising educational approach of a curriculum-embedded weight bias reduction intervention that consisted of 3 simulation-based encounters with standardized patients living with obesity. The study aimed to evaluate the effectiveness of this intervention in improving NP students' self-efficacy in clinical communication and weight-based attitudes and beliefs. Consenting NP students were randomly assigned to either the weight bias reduction intervention group or the standard obesity lecture control group. The intervention group received weight bias education immediately following the first encounter, whereas the control group completed the standard obesity lecture education after the first encounter and received the weight bias reduction education after the second encounter. Students completed validated questionnaires assessing weight bias attitudes and beliefs through the ATOP-HW and BAOP respectively, and communication skills via the SE12. Mixed effects models for repeated measures assess change in scores over time with an interaction between group and time. ATOP-HW scores remain consistent across the 3 encounters, with no significant changes across encounters or across randomization groups. BAOP scores improved from pre-intervention through 9 months post-intervention, though at different rates for the weight bias reduction and standard obesity lecture groups. At the second time point, the weight bias reduction group had significantly improved BAOP scores, while the BAOP scores for the standard obesity lecture group did not change. Once the standard obesity lecture group received training between encounters 2 and 3, their BAOP scores also increased significantly. Additionally, students did not have significant changes in SE12 scores across encounters or across groups. Significant improvements in beliefs about individuals living with obesity were observed following weight bias reduction. This shows that integrating this weight bias reduction model in NP curricula can reflect real-world interactions and build awareness of obesity and weight bias. Timing and number of education sessions may be crucial for achieving more significant outcomes. Providing patient-centered care improves outcomes, strengthens trust, and advances health equity. Larger, longer-term studies are needed to further assess how these weight bias reduction strategies influence attitudes, beliefs, and behaviors in both simulation and clinical practice. Special thanks to the Fitzpatrick College of Nursing Simulation and Learning Resource Center and to all the SPs who have devoted their time, energy, and expertise to this study.